On behalf of Seniors for Social Action Ontario, I would like to introduce Councillor Paul Sharman of the City of Burlington, who was recently featured on CBC's The National concerning the need to provide care and support for our elders in their own homes. Paul, what would you like to tell our audience today?
To talk about seniors and our aging process and the experience of our parents and our grandparents and why we can't repeat those. My background is, it's lengthy, so I'll keep it short. Basically, I'm a finance person, work for a company called Nortel, ran one of the largest accounting associations in the world in the United States, and have been a consultant for 30 years, reorganizing corporations. So it comes naturally for me to want to help on particularly important social issues, healthcare and aging being the ones that I focus on. I am presently a City of Burlington councillor in Ward 5. One of my roles is as Deputy Mayor, responsible for strategy, budget, process management, and performance measurement. In addition to that, I am president of the Region of Halton Community Housing Corporation. Over the last 5 years, I have worked with the community to address the question of how we can look after people as we age, to improve the quality of life, and at the same time to secure our futures within the context of a medical system that has got insufficient capacity. And as we saw recently with the COVID pandemic, my journey started with my mother, who in her 80s became unable to function that well. She was frightened of things. She was worried about what her neighbors were doing. She became paranoid. That's my language. It's not an official term. But we took her to a gerontologist, a doctor who gave her medication. And within 2 days, she was catatonic. She was not functioning. We had to bring my aunt over from Britain, who had been a nurse. And it took her 6 months to get back to a semblance of her former self, but not better. Subsequently, she sold the condominium she was in. She moved in with my sister, who happened to have an apartment in her big house up in Bellefontaine. But that only lasted about a year before my mother was unable to cope. And we were able to work with her to move her to a retirement home. And subsequently, she was unable to stay there. Her dementia was setting in, and she was deemed violent on an Earth Day one day. When the lights were off for an hour, she came back and somebody approached her. My mother was frail, but when she pushed the person who was a staff person, she was deemed violent. And at that point, she was on her way to a locked up ward in a long-term care facility. And that was a bad situation, because the minute you step into one of those wards, you normalize around everybody else's behaviors, and presumably many of them drugged and unable to perform the lives in a normal way. And what we saw was a deterioration and even pneumonia a few times, which seems to be the escape route for many people in long-term care. It was a bad experience, and from that we began to work on finding ways to improve the quality of life and care for our older adults. I will paraphrase the words of one of our executives, presidents, one of the hospital systems in Ontario, who said to me one day, "Paul, it's understandable, because everything that could have been done to stop somebody coming into a hospital has not been done in the community. Were it so, we would not have such a problem." And that's where I want to continue. What I see wrong about 3 million people in Canada who are over the age of 75. We know that the people over the age of 85 are the primary driver of patient load in our healthcare system. Further, we know that the number of people over the age of 75 is going to double in the next 20 years. So we're going to go from 3 million to 6 million. We estimate that about a third of those people, so 1 million now across Canada and 2 million across Canada in the next 20 years, are people who are demanding a driving patient load in our healthcare system. And our province can't afford the capacity to fight COVID, let alone the number of people who require their support going forward. So change is necessary. We have, and I have spearheaded this with the support of our president of our hospital. We have made progress in Burlington by way of working with an organization in the United States called PACE, Program of All-Inclusive Care for the Elderly. And over the last 5 years, since 2017, have created the first PACE center in Canada, in Burlington. It is a done deal. It is proven. It works. We provide 360-degree service to older adults in the place where they live. We have the ability to provide services to older adults in the community surrounding us. The way we do that is by following the PACE model. It is the gold standard in the United States. It allows people to have a higher quality of life. I should add that not only that, but I can talk a little bit about our purpose in terms of PACE going forward. We need to make PACE available to every older adult over the age of maybe any age who needs support services. And we can do that through PACE across Ontario and across Canada. Our purpose is to improve the quality of life and thereby the health of all members of our community as we age, and therefore reduce older adults' need for hospitalization, and therefore reduce the demand on the Ontario government and provincial governments to increase their capacity to accommodate the primary patient load of people over the age of 85, as that number doubles in the next 20 years. My message to you, Ontario, is please facilitate this. You are already working with many, many organizations across the province, not-for-profit, who you have contracted with to provide services to our residents, our community members, our citizens, our loved ones, our parents, our family members. You can codify that and you can coordinate it through the patient or the member coordinator role with those organizations, and they can make it all happen to make sure that we provide services to everybody. And you don't need to invest massively in the healthcare system. You need to redesign it. That means we can keep people out of long-term care. You know, lots and lots of people in there who don't have a health problem. We can keep them in their homes, as PACE does in the United States. We will do this. We can do this. We want you to endorse us and support us. With that, I'll leave it. Thank you very much.